Hi, I'm Drew Howard, one of the bariatric surgeons here at Memorial Hermann The Woodlands Medical Center, and do mostly waist loss surgery to help people kind of get their life back. Fortunately, for a lot of people, especially even in this time of COVID, people have gained weight and it's caused them to gain a lot of medical problems. We see people who are obese and morbidly obese who that brings on all the medical problems of diabetes, high blood pressure, high cholesterol, and sleep apnea. All these things come with the weight, and if we get the weight off, then all these things start to melt away, and people really regain a lot of their health and their life back. Do those through various surgeries here. The most common is the laparoscopic sleeve gastrectomy. We also do gastric bypasses and other revisional surgeries, all to help people and tailor it to exactly what they need.
Hi, my name is Wendy Jacobs. So I want to say it started around, I think July is when I talked to a friend that she had had it done and told me, everything that she was going through in the process and how it was changing her life. And for years, I've always been the skeptical one, and I can do this. Fad diets, gain the 5, lose the 5. Always, I had early on in my 20s, I had a total hysterectomy, which was very hard for battling my weight at such a young age. So after talking to her for several months, I decided I'm going to go in, and I, went in, got all the wonderful information that I received and the guidance, and started the process of doing my monthly weigh-ins and meeting with my nutrition. And I was more aware how I was eating at that point. I even went on a cruise and didn't gain any weight. That's never happened. And and since the surgery process, I did it for myself. I'm married of 30 years. I have 4 grandkids. I want to see them grow up, but I did it for myself. I'm scared of lab work. My labs have always been high, diabetic, high cholesterol, um, you know, just everything, and tons of medication. And every day I just look and say, why am I doing this to myself? I was killing myself, basically. And so through that, I am off all medications. My blood work is phenomenal. I'm so excited to get blood work now. Um, it's just, I had COVID in July. Without this weight loss surgery, I had probably ended up in the hospital. I was down for 3 weeks with it. I was extremely sick, and I am asthmatic. But because I've lost so much weight, I was able to, and be healthier, I was able to overcome that at home, very thankfully. And I have no problems at this point. I work out 3 to 4 days a week now. I do Zumba. I don't care. I don't care if people watch me. I love it because the person who I knew was inside is now out. And, that just shot out of me, and I love it.
Hi, I'm Dr. Jason Billette, bariatric surgeon here at Memorial Hermann The Woodlands Medical Center. Yeah, so COVID has really disrupted our practice. And as we worked through COVID, we noticed that patients were coming in to inquire about weight loss surgery. With COVID being present and obesity being a high risk factor for increased complications for COVID, we're seeing more and more patients come in to inquire about weight loss surgery. It's been shown that weight loss surgery actually decreases hospitalizations in the event that someone gets COVID after surgery. So we have noticed that uptick in patient volume through our office inquiring about that.
The number one thing that will determine whether you get in the hospital or from the hospital get into the ICU is usually patients' weight and them being morbidly obese. And so what we've seen is if we get patients, who had surgery right before the pandemic or right when the pandemic started, and they get COVID, it may not be as bad as if they has still had those 50 pounds, 100 pounds, and it gets off those medical problems. So it is a cure, not a cure for COVID, obviously, but it is a way to help prevent some of the symptoms from getting really life-threatening sometimes for COVID. Now, that's not obviously everything. There's more factors involved in the COVID pandemic than just that. But we're seeing it as a major benefit to help people make sure that they can get healthy and then stay away, hopefully, from hospitals and ventilators down the road if they actually get this virus.
So when COVID hit, our patient volumes decreased because all the medical providers were ready to help with COVID, depending on how it presented itself. But then as things began to stabilize, what we noticed is our volumes have increased with patients pursuing weight loss surgery. We've actually seen a 20 to 25% increase in patients through our offices pursuing weight loss surgery or metabolic surgery. It's clearly known that, again, if you have weight loss surgery, that your issues with COVID could be less severe.
So for people who are great candidates for surgeries, one, if you have any of those medical problems and weight has caused those, usually that's a patient with a body mass index, which is just a comparison of height versus weight that usually calculates out to above 30 or 35 and has those medical problems. Or if your body mass index calculates out to be what we put in the morbid obesity category, greater than 40, then you would qualify automatically. All those patients, once again, have to come to our office, which is right next door to the hospital here, Surgical Group of the Woodlands, and make an appointment. And then we walk them through by looking at their medical history and what they have done in the past surgically, as well as their medical history, what surgery is best for them. The main two that we do is either the gastric bypass, which has been around since the 60s, which is a lot of rerouting the intestines. But then the number one weight loss surgery in the country and here at our hospital is the laparoscopic sleeve gastrectomy, which we've here at this hospital been kind of on the forefront in the Houston area, having been doing these for over 10 years here and doing thousands of them. And helping all these patients lose weight. Why would you choose one over the other? Well, that's what we talk about in the exam room and in the office. But the main reason is kind of patient's comfort. The sleeve gastrectomy comes with a lot less risk than some of the traditional risks of the gastric bypass, with for most people the exact same results. Both surgeries are done laparoscopically, which means through a couple small incisions, usually 4 to 5. And patients are up walking around 2 hours after surgery, usually spend the night in the hospital, go home, and back to work the next week. So a nice recovery, and then just progress to the rest of their life.
I can run with the grandkids and I don't get winded. I get on the ground and I play with them. I mean, they're little, so I can handle it now. I mean, I just absolutely love it. My whole family has told me that I am a role model to them. They've all started watching what they're eating. My mother, down to all 3 of my sisters, have lost. My one sister lost weight on her own just by my story. And I think that's phenomenal. And I try to help anybody I can because I want people to experience what I have. And it's an easy decision if you just make it, and I wish I would have made it a long time ago, but you have to be at the right place at the right time in order to make that decision. And I'm just thankful that I had a friend guide me in that direction. And I had a wonderful surgeon who has guided me through this point. And at this point, I've lost 102 pounds in 13 months. So I'm very pleased with where I'm at.
So weight loss surgery, we started here in the Woodlands in about 2006. And we average between 500 and 1,000 weight loss surgeries every year between me and my partner. We have patients and patient stories that occur all the time. We have the good fortune of seeing somebody that comes in anxious and nervous for surgery, but We get to see them after surgery when they've lost 60 to 100 to 120 pounds, and we see a whole new person that comes through the door. So we see those stories all the time. And what's interesting when people ask me on the street or my friends ask me about the weight loss surgery, it's always the inquisition of what is the big thing that these patients see and do. Does somebody run a marathon? Does somebody do something crazy? And what's interesting, it turns out to be the small things that are the most powerful with our patients. Patients going to church and being able to sit down and bend over and pick up their purse. Those are all things that are tough to do when you have an extra 100, 150 pounds on. Going to the park, playing around with their kids, getting up from a seated position. All these things change in these patients when they lose substantial weight. Certainly we'll hear stories about big items like getting onto a plane, not worrying about a seatbelt extender and stuff like that. But it's amazing all the little things and how much they add up when you talk to patients to hear their stories. So when patients pursue weight loss surgery, typically what happens is they come in and they're nervous and a lot of anxiety because they're going into uncharted waters. For us as surgeons, what we do is provide an avenue on that first visit to just talk these things through. It's important for us as the surgeons and the patients to be on the same page. So we spend a long time talking to the patients about the surgeries, what they are, which ones to choose, which ones to pursue. And we also spend a lot of time with the patient talking to them about their medical problems, how their medical problems are going to be affected or improved with weight loss surgery. And you quickly find out as you go through that process that most patients that come in to see us, their primary goal is their health and resolution of their medical problems, diabetes, high blood pressure, stuff like that. Weight loss tends to occur, and it's nice that that occurs, but certainly going after those medical problems are one of the big reasons why we do the surgery.
Go in and have the consultation. It's not going to cost you anything but a copay. And you never know I didn't think I was going to walk out of there feeling the way I did and have the confidence that I had and just take that first step. And to this day, I do not regret that first step at all. And I tell anybody who asks me, absolutely, just go. Listen to what they have to say. They're going to guide you in the way they feel you need to be. And then it's in your shoes after that.
Come in and sit down with one of the surgeons and just talk it through. The good thing about that first visit is there's no surgery that's going to occur. That first visit is a discussion about the patient, their system, their medical problems, what works for them. Most of the patients will leave there and then have the ability to think about the options presented to them. And then we do a second visit, sit down again before surgery. So it's important for us at our office to have multiple visits before we do any kind of operation to allow the patients to mentally work through what it means to have weight loss surgery, what it means to go through the recovery process, and then pursue the surgery thereafter. So one of the important things that we do at our office is we have all aspects of preoperative progression through the insurance requirements taken care of in-house. And so we can set the patients up with their nutrition classes. We can set the patient up with their psychology evaluations, their follow-up visits. The other thing that we've done in our office is we have adapted with COVID to do telemedicine. And so we have opportunities for patients to use video links to call into our office, discuss the surgeries, prepare for the surgeries, and it allows them to really get the process underway without having the exposure of sitting in a room or a waiting room with a bunch of people. So we've noticed that has been a big help in terms of progression. The other thing that we think is important is aftercare. We have a scheduled follow-up visit plan through our office to see patients. We want to see them back at 2 weeks. We have to make sure the healing is occurring on the front end like we expect. And then we incorporate a registered dietitian on the aftercare as well as nurse practitioners that are certified in bariatric surgery and the surgeons. And we involved all parties to make sure that follow-up care happens. We see our patients back at 2 weeks, 3 months, 9 months, and 12 months after surgeries. We want a close follow-up with our patients to make sure that they're going through the healing phase appropriately. The other thing we like to do is keep an open line of communication with the primary care physicians. We want to make sure the primary care physicians are involved in the post-operative recovery process as much as possible, that continuity of care has demonstrated good success with weight loss surgery.
Well, the first and foremost is a lot of medical problems, like I said, just melt away. You have patients who are literally throwing away their diabetes medicines. They are throwing away their cholesterol medicines. They no longer have high blood pressure, and they're getting all of that back. They no longer need a CPAP machine and no longer snore and bother their spouse in bed at night. All these things go away, and usually within 3 to 6 months. But on top of that, they get a lot of their life back, right? I have patients who come to me and tell me about how, they walked in because they went to Disney World and Disney World wouldn't let them get on the Dumbo ride with their kid. And that was the breaking point for them. And, 6 months later, they're sending us pictures of them on the Dumbo ride with their 5-year-old child. That is life-changing. That is why we do what we do here. That is what makes me get up and get these people, and do their surgeries and just see the excitement that we see in them, when they come and just really grasp their life back is fantastic.
I bounced back really quickly. I have a desk job, so I had surgery, stayed overnight, went home the next day, recovered. Monday I was back at work. Within 6 weeks, I got to start working out. I don't know, it was like a relief. It's done. Now the ball's in my court. They always say it's just a tool. And I tell myself that all the time. It is a tool. I have to do the work. I was given the tool, and then you have to work it. And I'm part of support groups, and I'm a big research person. So to this day, I'm still researching stuff, how much protein can I get out of that versus that? Because it's all about protein, and, to start working out, you got to adjust how you're eating, for that calories that you're burning to make sure you're taking in enough. So do your research, there's not, ask people. That's what I suggest, because I asked someone and I was able to be guided into the right direction. I believe word of mouth is huge. I'm not going to go to somebody if I haven't heard good things or their experience, absolutely.
So when weight loss surgery started here in the Woodlands, it was primarily gastric bypass, the procedure that was done. And we've seen an evolution to the gastric sleeve, which is clearly the most prominent procedure performed today, particularly here in the Woodlands. And we've seen that change just based on how the surgeries function, how the patients do, the decreased risks that are associated with the patients. And as these evolutions in weight loss surgery have occurred, as for instance with the gastric sleeve, when you don't reroute the intestines, when you don't change the way the intestinal system flows, then the risk to the patient goes down. And as those risks became more and more apparent, we've seen an increase in patients inquiring about weight loss surgery.
I was never a sweet person, but I've learned that so many different ways you can cook chicken. I still, I'll have a treat. I don't deny myself of anything. You have to learn how to do things in moderation. Like my grandson's birthday. He turned 1 today. We're having birthday cake tonight. I don't want cake, but it's not because I can't. It's because I choose not to. And people have to understand it's a lifestyle change, but it's not a prison sentence. And people need to understand that your life can still be what you need it, and you can still eat. I go to restaurants and I eat. I just order things without a bun, and condiments on the side, and I pick and choose what I eat. But yeah, pretty much other than the spicy food, that's about it. I don't drink sodas, tea anyway, so other than that, your life should be just about the way it was. You're more wise about what you're putting in your mouth versus just picking something up and shoving it in. Makes you more conscious. Absolutely. My mom, she'll call me. every week, and she'll say, "Oh, I got on the treadmill for another 30 minutes and I was thinking of you when I was doing it." And, and so, I mean, she sees pictures that I send of her and she's like, "I just can't believe how amazing you look, you know." And I was like, "I didn't do it for that, but she's like, "You're such an inspiration that you took a hold of your life and you chose to change it and you've thrived on it." So it makes me feel good that I've encouraged my family to start watching what they're eating and to lose weight. I didn't do this to stick around and then not have anybody with me.
I think a lot of people come and they're scared. And they're scared either because of the anesthesia, maybe they've never had surgery, or they're scared, feel like they're taking a step that is, because they couldn't do it on their own. And the truth is, there was a huge research by the National Institute of Health that showed once people get to a certain weight, all they will do is just yo-yo, just a few pounds up and down. So what patients tell me all the time is, I've lost 500 pounds in my life, the same 30 pounds, every time, so because they're just doing this and seeing that, like I said, research has shown that, science has shown that to be the case. But what we see with surgery is the exact opposite. Patients lose the weight, and it usually takes about a year for complete weight loss, but they lose all the weight, they feel healthier, and then it stays off, because they keep following the diet, they keep following up in our office, and we make sure to help them through that continuation process. The number one thing people tell me later on, 3 months out, is my only regret is I didn't do this 4 or 5 years ago. And so, my encouragement was if people are just nervous about it, just come in and talk to us. I'd love to sit down with them and just kind of share the experiences. Call the hospital, talk to the people who've had this done. Come to one of the support group meetings here, and talk to the patients and ask them, "How was your experience? What do you think?" Because I think what you'll find is you'll get a whole bunch of cheerleaders for you, ready to help you dive into that big decision.